Now, I want to talk about the health strike in New South Wales today because, look, obviously, big dose of this stuff is about trying to get a message to the New South Wales government. Obviously, the federal government as well. The Nurses Federation has got very direct advertising at the moment about the federal government, but they did it at the last election as well. But, Prue, I just can't see how the New South Wales government would do anything but give a relevant pay rise above the 2% and a bit to people who they have been lauding for the past couple of years as the frontline workers of the pandemic. Not even about the politics, just about basic decency here.
I mean, that's the thing, right? Like, they get up all the time at press conferences and say, oh, we owe these pandemic heroes, you know, the fact that we got through the pandemic, and thank you, thank you, thank you. Thank you doesn't pay the bills, right? So, you know, for example, I was outside a hospital today with some of the striking workers in Penrith in Western Sydney, and they're all standing out there with their placards, people that have never really engaged in a strike before, just ordinary hospital workers, and people coming in to use the hospital were all saying, look, we agree with you, because, sorry, when it's come to the last 2 years, who among us haven't used a doctor or a nurse or, you know, the health system in some way? I think what you said before, Paul, about how petrol is through the roof, grocery prices are going up, inflation, you know, like, sorry, can we really expect Australia, New South Wales to be a state, or Australia be a country where someone working in a hospital is below the poverty line? That's not acceptable.
But also, what pisses me off about this scenario, right, is not just that they win the PR thing because we all love a nurse, right, but it's about what you value. Now, governments have got a lot of money. They've all shown us they've got a lot of money with hundreds of millions here and billions there and all the rest of it, right? It's not like they're turning around saying, you know what, New South Wales government, we're scanned. We can't make a single announcement between now and the next election. Sorry, guys, that's it. We're done. Now, obviously, an increase in pay is a permanent change to the New South Wales budget. But I'm sorry, we just don't, I mean, they can't have it both ways where they've got, oh, here's $400 million for national parks, but sorry, got nothing for the paramedics.
So
nothing for the paramedics.
So true.
I mean, this is the great problem that state and federal governments now have, is that, you know, debts don't matter. We're in this era of, you know, mixed monetary theory where we just print money forever. Well, you know, the problem is, you know, that inflation you talked about, Prue, that's what's going to drive it.
Exactly.
So I agree. Fine, give them a rise. You know, maybe the first thing you do, fire Carrie Chant, divide her salary up among all of them. That'd be great. But beyond that, though, you then will have every other public sector union, and this is a problem that you get into in state governments, which is that your recurrent expenditures go up and you can never get those down, and then where does that cost you? Your capital expenditures. So what does that mean? That means fewer roads, fewer hospitals, fewer of all of the things we want, or it means more debt, a lower credit rating, and a bigger drag on the economy.
Well, as I've said before, if nurses, AMBOs, and a big shout out to Andrew, who I met the other day just at the servo, glad that he watches the show, and thank you for the work that you do, mate.